medical sciences with about 200 beds, and very soon it became a point of care for trauma in Delhi and also a referral hospital for India. We receive at this time almost 125 to 150 patients every 24 hours, perform more than 5,000 major surgical procedures covering orthopedics, neurosurgery and trauma surgery, ICU admission close to 1,000 now. We have witnessed large number of mass casualty incidents since our inception, and we also are working towards the charter by the United Nations, the Decade of Action for Road Safety, which is from 2011-2020, and I am sure this is going to go beyond that, because we are not going to achieve what has been objectivized in 2011 to bring down at least 50% reduction in the road deaths. So where we fall in this, the implementation of these 5 pillars, the pillar 1 is the road safety management, 2 is infrastructure, 3 is safe vehicles, road user behavior is a lot to be achieved, but what we fall into the post-crash care, which involves pre-hospital care, hospital care and post-hospital rehabilitation and physiotherapy. We have been making some efforts towards developing team concept, which must have components from resuscitation to rehabilitation of these patients. Pre-hospital care, we have basic emergency care course, pre-hospital trauma life support course, and efficient hospital care. We have rural trauma team concept, which we are trying to bring up, trauma evaluation and management for our undergraduates, and then those who are providing acute care, the advanced trauma life support courses for doctors, nurses, and also what we have devised of our own is a ultrasound trauma life support. And ultrasound actually can prove to be a boon in resuscitating some of these patients very quickly without wasting time. And we'll discuss in our bilateral discussions about this. And of course, as I mentioned in the opening remark, that long-term rehabilitation care is a lot to be desired in, I think, in India and other nations too. Immediate care providers, we have paramedic training, doctor and nurses, because it's a teamwork, rural trauma team and advanced trauma operative management, short-term and long-term training at tertiary trauma care centers from around the country. It has to be a multi-pronged strategy. Injury prevention has to be at the forefront. And what we need, because since we have 72% of our automobiles are motorized automobiles on our roads are two-wheelers, helmet enforcement is the one key factor in reducing the burden of head injury, which consume maximal resources of the hospital with poorest of outcomes. Road user behavior and awareness. Again, there is no robust data except the NCRB data we have from various states, from various facilities. So we need to conduct injury research, having robust data by trauma registry, then organized pre-hospital care. It has begun already and it is working well in many states, I learned. Networking of trauma centers, facilities coming up around the country. Then trauma education and training has to be standardized. And that is what we must speak the common language when it comes to caring for these patients. And also not only related to trauma but also surgical critical care and critical care itself. Towards achieving some kind of a trauma system in India, we have got a funding under a Australia-India trauma system collaboration, and it was no less than a Prime Minister of Australia who was keen that this collaboration must go on. He visited us in 2014 September, precisely a year ago, and increased the funding for another 4 years under this project. Recently we visited, you might recognize this rainbow, double rainbow. We visited Melbourne and we discussed various interventions under this project which we are going ahead with our collaborators all across India and Australia. We started ATLS for doctors in 2009. We have conducted almost more than 220 courses so far across India. We have 2 sites in Delhi. Besides trauma center is the RML hospital. And then in Mumbai, Pune, Ahmedabad, Chennai, Pondicherry, Kottayam in Kerala, and we are going to have more sites in coming times. We also introduced the Advanced Trauma Care course for nurses in 2010 and pre-hospital trauma life support course for pre-hospital technicians. So I think the chain is complete. It is up to us to utilize these resources and make trauma a strong, robust team in most hospitals. At Institute, what we have done, MD in Emergency Medicine, there is a Department of Emergency Medicine, has been created. We also have a specialized course in trauma and critical care, and also the specialized course in critical care, DM in critical care, has been initiated. We are conducting short-term and long-term training programs for doctors and nurses from across the country. What we need to do, public awareness programs, which we did recently prior to a Indo-US Emergency Medicine Summit. We had a walkathon, creating awareness about injury prevention. We need to involve lay public. Put this in the school curriculum, which we have done. College students, community, media. And then only we can do justice and take care of these injured patients who come to us with varying situations. Sometimes we do have patients surviving following trauma, and these are young patients. That's why we do get good outcomes many a times. And this was first patient who had this angle iron penetration through his torso, and he survived and joined his work 1 month later, which brought this trauma center to the light to the nation and the worldwide. We had actually team from Japan Broadcasting Corporation coming and enacting the whole injury in this patient, and it was telecast in Japan. Containing injury epidemic, it's a huge challenge, and it's a social responsibility which all of us must come to the expectation. Awareness about injury prevention, injury research, standardized trauma education and training, and taking ATLS or ATCN philosophy to across India, subcontinent, East Asia, global for a standardized protocol-based trauma care. This was another injury, very unusual. We witnessed on a Delhi road where this boy, standing the Ivory Coast National along with his mother, he was traveling in a car, and on a flyover there was a stationary truck carrying these iron rods. His car actually rammed into that truck, and 2 iron rods penetrated his torso. He was impaled in the car, and he was brought to trauma center in that car itself, where he was extricated from that car, and Dr. Manish and Amit led the team to operate this boy who is standing in middle, and he survived. He was here to do some IT course, and he said, I'll complete my IT course and then go back to Ivory Coast. I take this opportunity to invite all the delegates from East Asia and other countries and India for 3rd World Trauma Congress, which we are going to have at Vigyan Bhavan from 17th to 20 August 2016. And I'm sure we'll have good deliberation from around the globe, because trauma is a global problem. I'll just finish with one video. Thank you all very much. Just to give you a little bit outside from your speeches.
While writing, it's multiplying. Shalini gets your point.